Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kabas Jahangir, and today from the JWC studio, I've got the ever great Dr. Dugal, who needs absolutely no introduction here in Pune. He's one of the leading cardiologists here at Jahangir Hospital and definitely in Pune and in the area. So, thank you so much for being here, Doc. It's been a long, long time having you here. Thank you so much. So the first question I have for you is that you've got years and years of experience in your field of cardiology. From that lens, it's one of my favorite questions to ask is that what does wellness mean to you?
Wellness is, of course, a positive health. You know, just a person exercising or, getting weight is not everything. There are many factors which one should take into consideration to have a positive health. And what we call it, in fact, the cardiology fraternity call is it's like you have eight essential things in life,
Okay.
which is basically a risk factors,
Huh.
and that helps in if you go follow that eight essentials, then you will be in a fit condition, and that starts from smoking, adequate sleep. Now, this is a factor which is not taken into consideration.
Yeah.
People want to work more and more. Oh, I sleep only for 3 hours. That's not adequate.
Like it's some badge of honor.
Yeah. So adequate sleep is a very healthy sign. Then comes your blood pressure, activity. That is very important. Lipids. Basically, there are many components of lipid, but there's certain lipids which are very important, especially the non-HDL lipids, which are known as low-density lipoproteins.
Right.
Then diabetes. Now, diabetes is one thing which is very important, and people, they don't take into consideration. Mango season, the sugar goes high, and then of course is the other factors is your diet, and your diet is a very important factor, especially with the urbanization. The diet has changed considerably. So these are the eight essentials which one should follow to have a positive health, not just you're exercising and your weight is okay or fit. That doesn't mean fitness.
I mean, there are many places that I can ask you about from these eight. I've talked about fitness with people. I've talked about exercise. I've talked about nutrition with people, sleep with people. One of the things that you mentioned, obviously, which is perhaps more specialized for you, is lipids. And today there's so much noise on the internet. People have access to their phones of getting misinformation, information. People talking about, oh, you should look at this test, you should look at that test. So let's sort of get a little bit deeper into the lipid side. What are the markers that people should be looking for when they do their blood or whatever it is for their heart health?
See, the most important thing is the lipid profile.
Okay.
So lipid profile has got multiple components.
Right.
Out of that, the component which is the most important is the LDL. This is known as low density lipoprotein. That also has a component known as oxidized LDL, which is the most important component. Now, the others are coming up is the lipoprotein A.
I was just going to ask.
Apoprotein 1. Now, this, when we started cardiology, it was not taken into consideration because that there was no treatment available. So you used to do it once in a lifetime.
I see.
Now, with the treatment available and know that as a risk factor, we are able to control this. So, therefore, there are newer drugs available which have been, the guidelines of lipids have been changed.
Right.
So, we want to get these factors into consideration, just not the total cholesterol or a LDL cholesterol. There are multiple components and each needs to be addressed individually. Now, there is another factor which has come is residual risk factors. Now, you have this eight essentials we have sorted out.
Yeah.
But there is certain residual. Now, the residual is like inflammation. You do a CRP, high density C-reactive proteins and
These are all blood tests.
These are blood tests.
Right.
Now, that means if it is raised, that means there you have an active inflammation. And now there are drugs to bring this inflammation down besides getting your lipid down. So we have newer drugs which can bring. So these are known as residual risk factor after controlling these main factors. So these are also getting important day by day, and the holistic approach is to do all of this, not just leave it at one.
And look at it holistically also. Right. I mean, now that that's becoming more, people are becoming more and more aware of that. Are you also starting to see a trend in terms of younger people starting to get more heart-related issues, heart-related diseases, and so forth?
Yeah, we have, we are in an active cardiology unit, and younger people coming with heart attacks are generally, if not proved otherwise, are smokers.
Right.
But, the very fact they smoke, and even their parents do not know. Once they come with a heart attack, we dig deeper into it that he was a smoker.
Yeah.
So smoking is in fact, in USA, 50% of cardiac death are related to smoking. So is in our country.
Right.
It is also related to strokes. And these are two major causes of death. One is heart attacks and one is a stroke.
From
Now,
smoking.
Therefore, smoking is a very important, now this has to be, control has to be done at the not at our level, even the government should bring it down,
Yeah.
like advertisement, passive smoking. Now, one is an active smoking,
Yeah.
I smoke, but one is my surrounding, my people, my friends, they smoke. So that is a passive smoking. So that is also harmful.
Yeah.
So one of the most important cause is smoking, which needs into, and like we have warning on the cigarettes, we have, not smoke
warnings.
in the public places, but it continues.
Right.
So they are the most vulnerable population. One is low income group, and diet, which is not good.
Right.
Diet should be more in fruits, legumes, grains, which are not there, and no smoking. And of course, then you have the exercise and other things.
Yeah. Yeah. What about the other thing that a lot of people like to think, if they have a red wine a day, that's good for their health?
No.
Or what is your opinion?
That's a very, very controversial question, and so is the answer. Now, we have been reading and we have been studying that small amount of drink, which is called moderate drinking, which is less in ladies and more in males. So, between 7 to 14 small drinks is good. But
What, per
week.
week, not day? No?
No. So, the problem is the wine is good for the heart. Now, why it is good for the heart? It brings up the high density lipoprotein, which is a protective cholesterol as far as MI is concerned. But at the same time, alcohol raises the blood pressure by causing vasoconstriction.
Exactly.
So the stroke is more.
Yeah.
So at one side, you are bringing down thinking that, and the second side. So it's a very controversial. Earlier, it was said that it is good, but now newer evidence says that it is not good.
That the cost
Now,
benefit probably doesn't weigh out.
and the other thing is, not only it causes it causes cancers, liver cancer, abdominal gastric cancer, pancreas cancers, liver cirrhosis. These are other things which,
Yeah.
you just get an ultrasound, there's a fatty liver. Why is it there? Because he's having wine every day.
Right.
So this is a control. As far as possible, it should be avoided. If a person is taking, I tell him, okay, continue small amount. But I cannot advise a person to take red wine because
Right.
he's going to go
Absolutely. So it
into
comes
the
down to
other
that,
side of
actually.
the.
Yeah, so something you would recommend. But you mentioned all these other things about what alcohol can do. But even taking a step back and going back to one of the essentials that you mentioned, it has such a big effect on sleep also.
Yes, sleep. In fact, there is a type of sleep known as REM sleep.
Right.
Rapid eye movement sleep.
Right.
Now, alcohol causes the rapid eye movement to go away. So you tend to get up, you go to sleep and you tend to get up because rapid eye movements are not there. So it disturbs the sleep pattern. And especially in a hot weather, if you take it, it disturbs it more.
Yeah, absolutely. What about other things that are now becoming not more, they've been around for a while, but now coming the news more and more? Things like drugs that are perhaps not exactly related directly for heart, but things like Ozempic and Mounjaro that people are saying now, actually, I also have a spillover benefit for heart health. What is your experience in
So
that?
these are the drugs which was initially worked out in diabetes.
Right.
But they've been found of tremendous benefits in obese patients. Now, there are basically 5 important points where it works. One is it decreases the major adverse cardiac events. And for us in cardiology, that is the major adverse cardiac events is having an MI, having a stroke, having irregular heart rate, death, sudden cardiac death. Now, this drugs which you mentioned, which is a semaglutide or Mounjaro, they protect from this in a significant way. They decrease the incidence. Then secondly, as the weight decreases with the diet, because it decreases your appetite, once you decrease weight, it also affects the lipids. Your weight becomes less, your lipids come down just by this drug. Your blood pressure also comes down if you decrease weight. Plus, it decreases the incidence of heart failure. There is one type of heart failure where the pumping heart is preserved, which is a preserved heart failure. There, it's got a tremendous benefit. Then, those patients who have already have heart attacks, they are further re-infarcts are decreased. Plus, it has got an anti-inflammatory effect on the vessel wall. So there are 5 major benefits of this drug.
Wow. Okay.
Yeah, there are some side effects, but that is acceptable within the range.
Right.
Having an
For the
eye
benefit that
problem
you're
or
getting.
pancreatitis, very, very rare.
Right, right.
But the benefit is tremendous.
Okay. That's quite encouraging to hear, actually, then. So are you starting to see more and more people taking that?
Yeah, in fact, my neighbors who have no hypertension, nothing, obesity, they have started taking. More and more people are accepting it, and in fact, the cost has come down now.
Yeah, exactly.
There is a benefit to the patient because the cost has decreased since after 31st March. The costs are lower. It's a very effective drug.
Right.
And basically, there are 2 major things: weight. Either you do a bariatric surgery to decrease weight, or these drugs. Medical management or surgical management. Surgical management has proved, but now this medical management has proved, and it also controls your diabetes very well.
Right. And then you can tie it in with your lifestyle of, doing exercise, eating right, and things like that. I'm
Yes.
sure it can just supercharge the effect.
This is a wonder drug, and it has recently come, and I think so with time, keeping our obesity in India quite common, so it will help, and so is diabetes. So this combination, this drug will be a tremendous benefit.
That's very encouraging to hear.
Yeah.
So, just breaking down again to the simple, someone just wants to look after their health, or particularly look after their heart health. What are the sort of tests that they should do once a year? How often would you recommend, and what they should do?
This is one thing which I want to do. Besides, I've said that the life essential,
Yeah.
which I've said 8 things. But another very important thing is coming in a CT scan,
Okay.
a coronary CT. Now, they have studied 16,000 patients which had no of this essential risk factor, nil. And they found that CT showed calcium,
Okay.
CT showed plaques, which are likely to cause heart attack. So this has become an independent risk factor. Taking this 8 essential out, a CT scan is a very good test.
But is it different to a regular CT scan?
No, it is the multi-slice CT.
So all you do is lie down and then
Yeah.
go
So
through.
it'll tell you calcium
Yeah.
inside that. And calcium correlates very well with the coronary artery disease. The secondly, it'll tell you what is the plaque. And this plaque, what is the lipid content of this plaque? Is it a thin plaque or it's a lot of fatty plaques? So therefore, then you can attack. He have no risk. His cholesterol is normal, but he's got a lipid plaque.
Oh,
So
interesting.
this is becoming another very important risk factor in evaluation of patients for this disease.
Okay.
And secondly, as earlier I said, is the residual factor, the C-reactive proteins
right,
and all.
right.
So there are multiple things which beside these essential things which we have.
That's quite interesting that you're saying that with the CT scan, if
Yeah.
if something like this comes up, even though the
No risk
lipid
factors.
profile might be
Yeah.
okay, that might show something up. So
Yes.
it's quite
So
crucial that someone does this.
They
as
have
well.
done this trial only on people who did not have any the life essentials, and they have found this.
Wow.
So therefore, that is also should be included if you want into a proper
And
health
something
check.
once a year or something.
Once.
Okay. Well, I mean, there's so many places that we can keep going on about, but I suppose the bottom line question is that if someone who's seen so many serious cardiac events, what is that one thing that bothers you in terms of when you see that kind of event or these so many kind of events that you think that this could have been so avoidable if they didn't do X, Y, Z?
See, as I've said, the most important is diet.
Okay.
Diet has to be good in legumes, good in fruits, and there should be potassium supplement. Potassium is also a very good hormone. So diet and avoidance of smoking and control of blood pressure. The other thing which, persons coming with reinfarct, their compliance to drugs is very poor. Once you're prescribed with certain groups of drug, they should keep on taking. I was fine, so I stopped it, and again comes with it.
Self-prescription.
So this is one thing. Following the risk factor treatment and having a good compliance to drug therapy, which are essential for you.
Right.
But somehow people leave it.
Yeah.
That is a one factor. And of course, smoking is the worst of all these risk factors.
Yeah, that seems to be
Yeah.
uncontroversial compared to drinking, at least, where I don't think
yeah,
there's
yeah.
been any dispute about the negative effects on smoking. Well, Doc, it's been absolutely fascinating hearing everything that you have to say, and especially the encouraging things about these new drugs coming out. these GLP-1 drugs in particular. Any last words that you'd like to, any thoughts that you'd like to leave us with that we haven't covered, or anything that you'd like to re-emphasize on?
The emphasis, we have a vehicle, we get it service done.
Yeah.
Every time we said, okay, 1 year, let's get a service done. But as far as your health is concerned, you never get health checked up.
Right.
That is what I want to say. It is very important. Here, I'm driving a car, it says service required, service required. But nobody, you see, you are also need to have, you should know your basics, you know your background, so you can treat it properly and you should have
Yeah,
a
absolutely.
positive health.
And I know that you're a big car enthusiast, so coming from you, that's a very important message. Thank you so much for being here, Doc. It's been an absolute pleasure.
Thank you.
Thank you all. And before you leave, do not forget to hit the like and subscribe button here at the bottom. And any comments that you may have, please leave them as well. Thank you and see you all next week.